Good evening, everyone. I, Dr. Rameshwar Vishwakarma, welcome to all of you in the 11th day free webinar series organized by IASA in association with Samragee Homoeopathic Clinic. Today is our 6th day, and it's our fortunate to have Dr. Shailendra Singh sir with us today. Heartily welcome, sir, and also welcome to all the participants for today's session. It's a very knowledgeful session. Uh, so get enjoy to all of you guys. Thank you for coming us, and thank you all of you.
Good evening, everyone. I, Dr. Chalashri Dansni, All India Homeopathic Students and Youth Association, Maharashtra Branch, Aisha. All India Homeopathic Students and Youth Association is one of the largest association in homeopathic students and youth of our country. This association plays a great role in upliftment of the youth and young homeopaths to take the responsibility on their shoulders. This is the association of the students for the students and by the students. The aim of this association is work selflessly for the upliftment of ailing humanity. We believe on the phrase united we stand and divine we fall. So this is the right time for all the young pets across the country to come together and work for the betterment of the nation to make India the most powerful nation by devoting their time and work in right direction for the nation. We organize free health camps, free seminars, free webinars, blood donation camps, and we have also developed our own library which we give to the students who are not able to afford books. Aisha family conduct own 9 OPDs at remote village areas. We also promote scientific and research-oriented mind to the youth by publishing their articles or presentations or any kind of literature which is of valuable for the homeopathic fraternity and for the humanity in our magazine called Homeo Vision. We believe in the importance of time, so our motto is to awake, arise, and work before it's too late because aim says I am always in motion. Our thoughts are our actions, so we believe in having a positive mindset to believe ourselves for rising above the mass, for achieving higher purposes of our existence. Thank you. Over to Vibha ma'am.
And now I would like to introduce about the Samragee Homeopathic Clinic, Dr. Lavanya. So homeopathy is a system based on the theory of treating like cures like. Homeopathy claims to stimulate healing responses to diseases by administering substances that mimic the symptoms of those diseases in healthy people. To provide the treatment of this wonderful system, Dr. Vibha Mevada, who is a budding and enthusiastic homeopath, has started Samragee Homeopathic Clinic on 4th February 2018 at Indore, Madhya Pradesh, India. Dr. Vibha Mevada did BHMS from in 2015 and did CCH Certified Advanced Homeopathy and MCAH Master Course in Advanced Homeopathy, which are short-term PG course from the most prestigious Song International Academy of Advanced Homeopathy in 2016. And ma'am is a certified instructor, scholar by Yoga Certified Board, Ministry of Arts of India. Dr. Vibha Mevada has been trained under experts like Dr. Rajan Shankar sir, Dr. Dinesh Chauhan sir, Deepak Gaikwad sir, and many more, and took many national and international seminars, and her articles and cases are published in many prestigious platforms of homeopathy like National Journal of Homeopathy, homeopathy.com, etc. By following the footsteps of father of homeopathy, Dr. Henneman, rare diseases are also being treated at Samragee Homeopathic Clinic. The main intent of Samragee Homeopathic Clinic is to serve people. Several health camps, medical camps, free yoga, and aerobics have been conducted at the clinic as a benefaction of people. There is no denying the talk that they do treat here the best to assure the satisfying result leading to a lifeline to better health. Thank you. Over to you, Vibha ma'am.
Okay, so good evening, all of you. As we all know, our today's speaker is Dr. Shailendra Kumar sir. Sir is a well-known name because of his unique clinic known for the Liver Cure Homeopathic Health Center. Sir is graduated from Fr Muller Homeopathic Medical College in 2007 and post-graduation in Homeopathic Materia Medica from Sri Sai Nath Postgraduate Institute of Homeopathy, Allahabad in 2012. Sir is a former associate professor and PG guide in Department of Organon of Medicine at Sri Sai Nath Postgraduate Institute of Homeopathy at Allahabad. Sir is a visiting faculty for training to IAS and PCS officers at Uttar Pradesh Academy of Administration and Management, Lucknow. He has delivered more than 20 lectures on health and wellness to IAS and PCS officers of Government of UP. Sir is a founder and director of Liver Cure Homeopathic Health Center in Lucknow, which is a specialized center in homeopathy for the liver diseases. This is the only center across the globe in other than Allopath which has fibroscan device for transition electrograph of liver since 2000, January 2020. Having vast experience in treating liver diseases since 2008, and Sir is a PG scholar in health administration from University of Phoenix, USA. So this is about, in short, about our today's speaker. Now, without wasting time, I just want to request Sir to start the session. So it's over to you, Sir. Thank you so much for being on our platform today. Instead of we know how busy you are in your practice because I know about your center and how difficult cases you are dealing there. So thank you so much for getting time to for us and accepting our invitation for today's session. So thank you, sir.
Good evening, everyone. Thank you, Vibha, for nice introductions, and thank you, Aisa, for giving me the platform. So we are going to start our today's topic. We are not going to waste much time. So just a minute. Give me a few moments. Okay. Today we are going to deal with the. My topic is only always liver. So today's topic is riding new waves in liver diagnosis, staging, and treatment. The topic riding new wave. At least it took me 12 years to come over with this slide. So we are going to cover today in brief liver and its function, clinical application of liver test, liver disease, alcoholic liver diseases, diet and nutrition, homeopathic management, and few cured cases. So before starting, just read this: is life worth living? It all depends on the liver. This is said by the William James. He was a great philosopher and psychologist in US in the end of the 19th century. So he said that time, I think more than 120 years back, how liver is how much important. Now start with the in brief functions of the liver. As we all know in anatomy that liver start from the its work start from the beginning in the third week of the gestational period. It start making blood. The first blood start making in the liver, then bile production and secretion, detoxification, clotting factor. Liver plays a central role in the metabolism of carbohydrate, lipid, proteins, and most important thing, what liver does. Now we came to know this in 2020. All doctors know, everybody know, but focus for the immunity. When the COVID came, 18 to 90% of circulating innate immunity protein made by hepatocytes. So you can see how important liver is. See, this journal published in 13th April 2020, Journal of Hepatology. They have taken a sample of 417 patient COVID positive patients. In that they found 76% patient would have abnormal liver test. So you can see those liver test was abnormal earlier. Their chance to get COVID was more prominent. So you can see how liver is important for our life. Now this I'm going to show you a electron microscope image for the liver. See, you can see in this, just a minute. See, this you can see this is a biliary canaliculi, this is erythrocytes, and this is the Kupffer cells. I think all doctors will be naming the functions of the Kupffer cells. These are the residence liver macrophages and plays a critical role in maintaining liver functions under psychological condition. They are the first innate immune cells and protect the liver from infections. So this is a beautiful image. You can see how our liver is. Now come to the clinical application of liver test. See, no one single test can be used to assess a liver function test. We need a variety of tests to diagnose the liver diseases. And liver function test, actually it's a misleading term, as this includes several biochemical tests that reflect liver injury, not the liver function. So what we have to do whenever we have prescribed, so we have to prescribe what test we want. But India, it's a very common, we had panel like a liver function test. But now some modern hospitals are prescribing just for the, investigating, giving the order like bilirubin, SGPT, SGOT, not under the name of liver function test. Now, in the brief, this is the bilirubin. The normal level should be the 0.3 to 1. This is required for the diagnosis of the jaundice and assess the severity of any liver disease. Alkaline phosphatase, the normal limit is 35 to 130. This is for diagnosis of cholestasis and hepatic infiltration. If any obstruction will be there, this test will be, this alkaline phosphatase will be increased. So AST and SGOT, this is a normal is 5 to 40, and this is early diagnosis of hepatic disease and follow progress. This is the most important test. Align transaminase, ALT or SGPT. So I'm going to tell you one important thing for this test. The normal limit is 5 to 35. But if you will see of your patient, if some patient come and their normal limit, their SGPT or ALT level is less than 10, you will find they will be having no disease. So if anybody's SGPT is less than 10, so this is indicate the person is very healthy. And now it's a belief, if somebody is keeping their SGPT level is less than 10, so they can live up to 100 years without any disease. So such an important enzyme this. This is now come to this is gamma GT. It's a normal value is 10 to 48. Diagnosis of alcohol abuse and marker biliary cholestasis. This is a very important marker. If any obstruction is there in liver, if it is any person, patient is consuming more alcohol and not telling, with this test you can make it out. Now albumin for PR usually is done in for to assess severity, how disease is progressing, and gamma globulin 2 to 3.5 diagnosis chronic hepatitis and cirrhosis and follow course. Now PT prothrombin time. This is a very important test for the advanced liver stage. We have to do this test. Later we'll tell the importance of this test. Few other tests are there, like for autoimmune hepatitis, we have to do for this AMA, this anti-mitochondrial antibodies, anti-smooth muscle antibodies, ceruloplasmin for the Wilson disease, and viral markers for hepatitis A, B, C, E. Now come to the latest, this diagnostic kit for the available for the liver diagnosis. This is called transient elastography. There are two devices worldwide. One is a FibroScan, second is a FibroTouch. So after this device since came, earlier for diagnosis of the liver, we need to do the biopsy. But with the help of this device, within 5 to 10 minutes, we can make it out the liver fibrosis stages. So, and very proud to say that in homeopathy, we have this. This is the first machine we have in homeopathic clinics. So how this machine works? Actually, this machine works with one probe is there, which is the ultrasound wave and seer waves. Continuously, this probe we put in the liver, anatomical position of the liver. This And after this, we can this ultrasound waves pass, and seer waves passes the ultrasound waves, capture the velocity of the seer waves. With this, the computer interpreted the few results. First one, the seer waves travel very fast in the fibrous liver and very slow in the normal liver. So with this, algorithm, we make some results. So it comes like in KPU, kilopascals. The normal limit of the kilopascal is up to 6. So this is the reading which comes in. So suppose that if you'll see the any fibroscan report, that there will be written in the KPA. Suppose that's a 7 KPA. So you can see the fibrosis is in sets in. It's in F2 stage. So this is the reading which are showing in the computers. You can see this is the liver tissues and this is the seer waves. This is the sound waves. And this is the report 10.7. That means this is the fibrosis 3. So liver diseases, which are there: alcoholic liver diseases, fatty liver, non-alcoholic steatohepatitis, viral hepatitis, drug-induced liver diseases, Wilson diseases, liver cirrhosis, liver cancer. So in 80s and 90s, I'll show you the spectrum. So 50% of liver diseases are due to hepatitis B virus, and 15% of alcoholic liver disease. 15% were cryptogenic, 10% were HCV, hepatitis C, and 10% others, metabolic and other diseases. But now come to the 2015, you will see the 44% of alcoholic liver disease. So you can see the graph has totally changed in the 15-25 years. HBV came down to 15% due to the help of vaccination, SCV 11%, NAS is 12%, but within 5 years, the last 5 years, NAS is increasing. Cryptogenic is 11%, autoimmune is 7%. Now, today's topic, alcoholic liver disease. See, everybody is asking how much is risky. This is a very important question. How much alcohol can damage the liver? If suppose that any individual drinks less than 2 drinks per day, that means 20 grams per day for a woman and half of the for women. So, nothing will happen. But if this quantity goes more than 5, and the person having obesity, the risk goes to twice. If person has diabetes, risk goes 4 times. If it is hypertension and he is taking paracetamol, then the risk of developing the alcoholic liver disease will increase. Now, effect of alcohol to the body system. Liver alcohol affect approximately all the organs, brain. Even in esophagus, it can lead to cancer. Heart, it can increase your cholesterol level and increase your blood pressure. Liver, this is we are going to discuss further. Stomach, it can lead to acidity. Pancreas, it can create acute pancreatitis, which is a very fatal. And immune system, it will decrease your immunity. But one thing I'm going to tell you, whenever the patient enters in your clinic, if you see parotid is swelling. Suppose that this is the first symptom of alcoholic fatty liver. And second diagnosis is there if person may have a NAS, non-alcoholic steatohepatitis. So if you ever see parotid swelling, apart from the normal, infection is not there, so you just go for the scan and check what is the condition of liver. Now, spectrum of liver diseases. So chronic alcohol consumption, healthy liver goes to alcoholic fatty liver. 90 to 100% develop this. Out of that, 10 to 35% people will develop alcoholic steatohepatitis. That means fibrosis. Liver थोड़ा सा कड़ा हो जाता है in fibrosis. Then it go directly to the liver cirrhosis, 20%, or it may go to alcoholic hepatitis. Then alcoholic hepatitis may convert to the alcoholic liver cirrhosis, and if treatment is there early, then again it can be reversed. Now the 2% may goes to hepatocellular cancer. These are the modifying factors: genetics, sex, ethnicity, obesity, other underlying liver diseases, nutritional status, iron level, drug and xenobiotic consumption, smoking status. Now this is the normal hepatocyte cell. You can see this is the normal. Now come to the alcoholic hepatitis. In this, what you can see, just you see the Mallory-Dank bodies. Go back to the pathology and you remember Mallory-Dank bodies. It's a formation, is Mallory-Dank bodies formation is considering to the result from an excessive burden of misfolded protein accumulation and sequestration of these abnormal proteins in the cytoplasm of the hepatocytes. So you can see these are the Mallory-Dank bodies. See, this is a clear-cut. Earlier when you go for the biopsy, you'll see we can diagnose the alcoholic hepatitis. Now see what happened in the alcoholic hepatitis. See, the ballooning of the all hepatocyte got ballooned. So that means triglyceride got accumulated in the hepatocytes that results the fatty liver. See, the advanced fatty liver stage, what happens? So you can see the collagen fibers. You can see the collagen fibers are made in between the hepatocyte cells, and these leads to the scarring. So that's why this is a clear-cut advanced liver cirrhotic image. In that you see these are the fibers. So if this, because of this fibers, it will act like a barrier. So no blood nothing can go this side or that side. See, this is electron microscope image of the fibers. Now this is the end stage of alcoholic liver disease. This is a cirrhotic liver. You can see a chicken wire image. Chicken wire like things is there. All hepatocytes. It became like this is totally fibrous liver. So come to the today's topic, alcoholic hepatitis. This is a clinical syndrome of inflammation of the liver, hepatocyte injury, and fibrosis that occur in the settings of recent consumption of large quantity of alcohol. How you will diagnose the alcoholic hepatitis? So first we take the history, years of heavy alcohol consumption, recent jaundice. Now the sign and symptom. The most common sign of alcoholic hepatitis is yellowing of the skin and white of the eyes called jaundice. Ascites. Other signs and symptoms include loss of appetite, nausea and vomiting, abdominal tenderness, fever, often low grade, fatigue and weakness. Physical examination will see the jaundice, tender hepatomegaly, fever, ascites. Now the very important thing I'm going to tell you, you can diagnose after seeing this liver test. Clinical finding, the SGOT will be 2 times higher than SGPT. Suppose that patient ka SGPT 50 hai, so SGPT will be more than 100. Bilirubin will be more than 5 mg per dl. INR will be 1.5, more than 1.5. High leukocyte count will be there, and when the patient, we will do the fibroscan, the KPA will be more than 10. Severity of alcoholic hepatitis. So how we will make it out the patient, how much severe is there? So there is a discriminant function, there is a one calculation. There's a very simple calculation. This is 4.6 into difference in PT. What is difference in PT? Suppose that किसी patient का prothrombin time 10 या 15 है, suppose that 16 है and control is 12. So 16 minus 12 is 4, and then it will multiply by 4.6. So 4 into 4.6 into 4, it's a 20, approximately it become 24. And in that you have to add bilirubin. If suppose that bilirubin is 5, then DF value will come approximately 28. So if DF value is more than 32, please don't take that case, because these patients will die, 60% patient will die in a month. And this is a very advanced phase of liver disease. Less than 32 DF, you can take the case and you can manage with homeopathic medicine. But I will show you in some cases we have managed a DF more than 32 during the presentation of my cases. Some other calculations are also there presently, like MELD in hospitals they are doing. This is a chart, calculators are there, you can calculate with this. Classical alcoholic hepatitis, these are the patients who are admitted. For them, these scores are important. Now this is an audit score. This is we have kept in our clinic for this every patient who comes and the history of alcohol. So we give the chart. There are 10 questions, that set of 10 questions. So in this question, uh, you can see the markings are there 0 to 4. So if the total comes more than 15, that means person are on alcohol dependence. If it is more than score is coming more than 5, that means he is in a higher risk. And if the third question is negative, then no need to conduct this test. Now come to the what protocol we are following for the alcoholic hepatitis. If DF is more than 32, then aggressive nutrition we have to give 3000 more than 3000 calories, frequent repetition of medicine, and if less than DF 32, normal medication what we are following in our training we can follow that. Now come to the diet and nutrition. The goal for the nutrition support in ALD. What is the goal? So the goal, if we will give the more 3000 more calories, then it will help in liver regeneration, immune restoration, and prevent hypoglycemia and decrease ammonia production. So we can save the patient life. Now, nutrition prescription, what should be there? See, 30 to 40 calorie per kg body weight per day we have to give. And in that we have to give 30% of fat and apple. Earlier fat was restricted in the liver diseases, but now we are giving, why we are giving? We will tell you the next slide. Protein 1.2 to 1.5 gram per kg weight. We have to restrict the sodium, less than 2 gram we have to give, and we have to give frequent meal, 4 to 7 meals per day. Multivitamins, B complex, zinc and selenium we have to give. So why fat and apple in alcoholic liver disease? So actually alcohol leads dysbiosis and endotoxins in gut. So what fat does? Fat and pectin. Pectin, apple contains pectin, so that's why we are telling to the patient give the apple. Fat and pectin is good to resolve dysbiosis, and it increases good bacteria which prevent gut leaking. So we can prevent the ascites if we can give this. Now come to the homeopathic management. See, for homeopathic management, we must know the aphorism 3 each and every line. So this is the very lengthy aphorism, but each and every line is having your full confidence for your practice. We should have a knowledge of disease, indication, knowledge of medicine, medical power, and this is the most important, respect to the exact mode of preparation of quantity, preparation and quantity of it required proper dose. Dosing is very important to manage the liver diseases. See, one interesting thing I'm going to tell you all, what allopathics are thinking about in homeopathy for the liver diseases. In 2019, they published there is a Journal of Clinical Gastroenterology and Hepatology. This is an international journal. What they said, they blame our Chelidonium. It is a, I mean, there is a one disease called drug-induced liver injury, DILI. So they are telling that Chelidonium can damage the liver. See what the things are going on against homeopathy. So we must aware, and everybody knows Chelidonium is a wonderful drug for homeopathy. And I mean for the, and they are saying, now they started saying in their journal. So that's why we has to make a documentation for each and every cases. I will tell you how to do that. So you can show them, you can publish in the journal. This is a, I mean, they can publish anything, but we have to publish against this. Now see, Professor Hans Popper said something. He is called the father of hepatology. He said anyone who can stop or delay liver fibrosis would be able to cure most chronic liver diseases. If you can stop liver fibrosis, that means you can cure the liver diseases, and homeopathy can do that. See, what is silymarin and urodeoxycholic acid? Because I'm not able to interact with everyone. Otherwise, I would have liked to hear from you what is silymarin. So these are the two important drugs which are used by in allopathy for every liver disease, but outcome is nothing for them. Actually, silymarin is the active principle of Cardius marinus, which are using more than 100 years back, and urodeoxycholic acid is nothing but chelidonium. So these two medicines they are using. Now commonly used medicine at liver cure for ALD, chelidonium, carduus, marica, hydrastis, cheonanthus, and cinchona, cascara, apocyinum, apis, acetic acid, lycopodium, feltauris, selenium, syphilinum, terminalia, chabula. These are the important medicine we are using for the alcoholic liver diseases. The one important suggestion I am going to give you all those who are watching: never use mother tincture in alcoholic liver disease. This is what they found and they published in their Journal of Hepatology in 2019. When you use, because suppose that doctors are giving mother tincture to the liver patient, so one dose we are giving 20 drops in 3 times a day. If suppose that you have given 2 or 3 medicine together, so you are going to give a burden to the alcoholic burden to the liver patient. So my humble request: never use mother tincture. See, there is a latest technology at fecal microbiota transplantation for alcoholic liver disease patients started in ILBS in 2017. What they are doing, they are taking a healthy fecal matter and they are giving with the Ryle's tube to the patient, and for the regeneration of the liver cells and everything, and patient getting better. So this gave me idea to use our bowel nocebo. So I started using psychotic O and fitalis to the patient, and result I'll show you in the when I'll present the cases. See, I'm going to start a present a case, a very challenging case it was. Patient, this this is earlier report. Patient has not come to us, but you can see his reports. Serum bilirubin is 11.53, creatinine is 2.96, DFI calculated 39.30, which is very danger. Patient is not with us. He is admitted. Now, see, leukocyte is 25,000. So you can see the infection level. And prothrombin time is 19 seconds, very high. Serum urea is 72. We took the case at this stage on 11th July. Patient attendant came and shown the report. Bilirubin was 18.2, 18.12, and SGOT was 113, SGPT is 37. You can see alcoholic hepatitis, what I told earlier. SGOT will be higher, more than 2 times than SGPT. You can see here it's approximately 4 times. So I took the case, but in this report, DF I couldn't calculate because prothrombin time reports are not there with us. So I have given cardos marinus 1x TDS, alternate with the chelidonium 2x and apis 4x 1 dose for 3 days. Patient came on the 14th July. Patient report came, patient is still admitted in the medical college. No change in serum creatinine, better than liver markers. You can see bilirubin is 17, it came down little bit. SGPT and SGOT came down little bit. So we continue the same medicine, but apis we have increased the dose to 200. And creatinine you can see 2.67. And here DF was 57. DF calculation, you know, you have to calculate with this difference. The prothrombin time is 23 seconds. So normal is 12 seconds. So 11 second is here. So 11 into 4.6 plus bilirubin. Bilirubin was 17. It will come around 57 plus 1, 57.1. Now 17 July. After 3 days, you see the creatinine became normal. It came to the 0.87, and his SGPT came to the 18, SGOT came to the 67, and serum bilirubin came to the 15. Sorry. So here DF, but DF value got increased. This is a very big tension for us, and allopathic doctor told to the patient there is a no hope. Then after 2 days, we have given the medicine, the carduus 4x and chelidonium 4x, and ceonathus we have given because some spleen involvement was there. Psychotic doco we have given in 32 potency TDS for 3 days. On 19th, we got the report. See, the bilirubin is coming down, and SGPT, SGOT also is coming down. 19th, you see the DF came 26. Prothrombin time came to the normal. And then this is the after introducing of the fecalis. Now we increase the potency fecalis 202 Feltauri to reduce, because jaundice is not coming down bilirubin. To reduce the bilirubin, we introduce here Feltauri and lycopodium 200 one dose we have given. On 23rd, a patient came. So PT we couldn't take because PT sample was clotted. And July 24th, report came to the normal. So we have given Cardus 3x VD. Within a 15 days, all things came to the normal. CF bilirubin is 0.99, SGPT 76, SGOT 48. Now you can hear, see the we done a elastography of the liver. In that, without liver, only liver enlargement was remaining, and fibrosis is not there. See the patient video I'm going to play. You can hear.
Dr. Shailendra Singh ji,
Now come to the case number 2. See, the patient named Balakram. This is before beginning the treatment. He was admitted in some hospital. Bilirubin was 4.32, SGOT was 76, and SGPT was 90. There is a leukocyte count has increased 18,000. So these are the before beginning treatment. Albumin level was very low. See, before beginning the treatment, DF was 48.4, very high it was because PT was 22.9. Portal hypertensive gastropathy was there. It is a clear-cut case for the alcoholic hepatitis and liver with advanced liver cirrhosis. So patient was admitted in the Ramakrishna Mission Hospital in Lucknow. Alcohol, it was due to the alcohol. That time they discharged with this report. LFT was, bilirubin was 2.4 and SGOT was 61 and prothrombin time was 34. Sorry, SGPT was 34 and INR was 2.35. Prothrombin is 24.8. So they were not able to manage this case, and their patient was also, they told for the liver transplantation. And patient came to us on 3rd of August with the pain, abdomen, gross ascites, portal hypertension, weakness, unable to speak. Bilirubin was 2.4, SGOT was 66, AST was 66, ALT is 34, but PT was very high. So due to this, the DF is very high, 56. So we have given the medicine acetic acid, chelidonium, and ceanothus. Within 7 days, the leukocyte count almost came to the normal. Bilirubin came to the normal. SGOT and SGPT came to the normal, and most important thing, prothrombin time is just came to the normal. So on 10th, within a week, there is a no pain, no ascites, weakness, serum bilirubin came 0.7, AST is 54, ALT is 28, PT is 16. And I given a lycopodium 1 dose, chelidonium 2x for 3 for 7 days, and chincona 1x TDS. Patient came on 28 August. You see his leukocyte count came to the normal. Bilirubin is slightly high, 1.5, and SGOT is 32, SGPT is 23, and alkaline phosphate is slightly raised, but the prothrombin time is normal. So much better. So Cardus 3x given for the 15 days. And 19th September patient came last year. You can see all reports are almost normal. Everything is normal. Now you can hear the patient. See, these are the two cases we have seen. These both patients were advised, for liver transplantation, and these patients are still with us and doing very well. Now, this is a very new thing I'm going to tell you all as a doctor. See, the cases of alcoholic recidivism. Recidivism is the term where after successful treatment, patients start drinking, and then nobody can do anything, and patient will be no more because alcoholic hepatitis, severe alcoholic hepatitis, where DF is like this more than 32, after getting cured, the patient, if they start drinking, then nobody can save the patient. I'm going to show you the two cases for alcoholic recidivism. See, this patient named Mr. Krishna came in 21st of June in 2018 with a fever, weakness, pain, abdomen, tenderness, right upper quadrant, highly irritated, chronic alcoholic constipation. Serum bilirubin was 2.4. See the AST level. SGOT level was 408. ALT, SGPT level was 275. We have given a medicine Chalidonium carduus alternatively and Camomilla 201 dose for his irritation. See, this is the report when he came to us. Now on 6th July, after 15 days, this patient his bilirubin came to the almost to the normal, AST by half 223 and ALT is 130. So we have increased the potency because we are expecting to the normal AST and ALT level. See, on 11th of August, there is a no symptom. Patient reports came to the normal, but GGT is very high here because patient was a chronic alcoholic. So we given Feltaury 3x, and with this report, patient went. But he started drinking again. He was a chronic drinker. Again, he started drinking, and he came to us with this report on 29th April. See the report of the patient. What he has done with his liver. Bilirubin came to 14.97 just after 2 years. Leukocyte count, you can see the 22,000. SGOT you can see 356. SGPT you can see 84. Always the ratio is maintained. Prothrombin time is 20 and this difference here, discriminant function is 50. So it's a very difficult to take the case. Allahabad has told because during the lockdown there was no admission and everything. The patient came to us because he has taken treatment to us. His fibroscan level you can see report 66 kPa. That means it is a clear-cut liver cirrhosis, advanced liver cirrhosis. So on 29th we have given the medicine Picalis 202 potency, acetic acid, carduus, and ceanothus. We have given medicine here for 15 days because patient came from the far and during lockdown they can't come frequently. So when he came after 15 days, you see the result. His LFT came to 9, SGPT came to 53, SGOT came down to 125. The prothrombin time came down by 20. So DF value came down by 43. Here it was 50, now it is 43. Ascites was much better, weakness was better, appetite is increased. So we have given a Medica because prothrombin time is still high and phosphorus 201 dose, chelidonium carduus. These are the medicine we have given. So after 7 days again we call the patient because still bilirubin is high. Now his bilirubin is 8.23. Now you see the ALT level is came down by 60 and SGOT by 147. Gamma GT also got reduced. And his prothrombin time is came down to 70. Almost it's the patient is went to the out of danger. Now it came to 29. So we have done a fibroscan and the reading from 61 to came down to the 18.4. The patient came after a month on 20th June. Bilirubin came down to 4.59. His SGOT, SGPT came to the normal 26. SGOT came to the normal 61. And gamma GT also came to the normal 60. PT came to the 17. DFS came to the 23. So again, we have done a fibro scan. You can see the reading is came to the 11.4. It's almost normal. But what happened? You see the patient when he got after 11.4 is KPA. See, but this patient is no more. After going from here, he started drinking again. So the patient party contacted us and told if they couldn't be, actually we tried our level best and we treated also. We have given the results also. So his liver also started functioning, but we can't do. Now come to the similar case. Mr. Sunil Kumar Gautam, 40-year age, he came on 29th of this last month, September, last to last month, with gross ascites, weakness. Patient was in unconscious state. Hemoglobin was 8, platelet was just 70,000. Bilirubin was 12.98. AST was 316 and ALT is 128. You can see ratios everywhere maintained more than 2 times. So you can see his reports. 316, 128, SDOT and bilirubin you can see 12.98. We took the case and we given the medicine Ficalis, acetic acid because of ascites cardus and ceanothus for 7 days. After 7 days, ascites reduced, hemoglobin came, it is almost same, but platelet increased from 70,000 to 1,22,000. Bilirubin came down by 5.4. AST came down, ALT came down, PT we have taken, and DF was just 4.9. And we have given, we increased the potency for the acetic acid 6C and cardus 2X alternatively with chelidonium. You can see the report here. But what happened? This patient also started drinking and this patient also is no more. So you can see what I told. The alcohol, this is a, if some patient is taking alcohol and after diagnosis, after treatment, whenever they get cured, they started taking alcohol and that is fatal for them. Now the data of ALD patient at liver cure, you can see this is data from 2016 to 2019. Out of 517 patients we have taken, in 168 cases were more than DF or more than 32. In that 80 patients died within 4 months, 58 responded well, 15 cured within a month, and 15 left the treatment. Now the ALD where the DF is less than 32, the 410 cases we have taken, and the success rate is very high, 250. Cured, 30 patients cured within a month, 40 dies in a year, 60 left treatment, and 30 they are not reported for the second prescription. So now very important thing, how to make liver healthy and smart. This is for everyone, for the patient also, for the doctors also. We have to maintain our body weight. How to maintain a body weight? Suppose that we are in 177, 170 centimeter हमारी height है, तो हमारा weight 70 किलो से ज़्यादा नहीं होना चाहिए. And for the female, अगर 10% कम, यानी कि फीमेल की हाइट अगर 170 सेंटीमीटर है तो उनका वेट जो है 70 का 10% कम हो गया, 7 किलो, यानी कि 63 kg से ज्यादा नहीं होना चाहिए। और वेस्ट साइज हमारी मैक्सिमम 34 होनी चाहिए मेल की, फीमेल की मैक्सिमम 30 होनी चाहिए। और 30 मिनट रेगुलर एक्सरसाइज होनी चाहिए। रेगुलर लेवर का चेकअप अपने जन्मदिन में, अगर आप 30 साल से ऊपर है तो हर साल जरूर कराएं। So with this, we have come to the end. This is our center. So thanks a lot. Now over to the Dr. Vibha. If any question is there.
Yeah, so thank you so much for this wonderful session, sir. I think you enlightened so many new things, so many remedies which are available, and you give an example that how we can by homeopathy only we can tackle the cases, the emergency cases, and the cases we can found that purely the pathological cases we can treat with the homeopathy only. So. Uh, Audience, if any question regarding the session, you can put on the chat box. Till now, there is no question, sir. But, okay.
Vibha, how, if any question is there, they can contact me. My mail ID is there, and my
Yeah.
mobile number is there. They can contact me on WhatsApp.
Okay, sir. Okay, no problem. So, if anyone have any doubt, sir, put it their contact number and email ID there. Sir, one question is here right now. So, fatty liver is the most common problem. How to get rid of it?
Okay, I think Mr. Arun has asked this question. Okay, Arun, fatty liver is the most common problem. So for fatty liver, you have to get rid of with the weight management. So just what I told you, you manage your weight, reduce your weight, regular exercise, and fatty liver for the youngsters. If any fatty liver is there, it doesn't require any medication. Healthy diet and exercise, weight management, everything will be all right. And second, I think in non-alcoholic patient, if alkaline phosphatase increases, that means there is any obstruction. That can be the gallstone, whether it can be any cholestasis, that means obstruction in the bile flow. So you have to rule out these things. It's not there कि alcoholic patients में ही alkaline phosphatase बढ़ेगा. At the gallstone cases में alkaline phosphatase you can see, advanced liver disease alkaline phosphatase you can see. Somebody is asking, can we give tincture? No, never give tincture in liver diseases. You can give tincture in fatty liver, everything, but once the liver fibrosis sets in, and any alcoholic hepatitis is there, any hepatitis is there, don't give liver tincture, mother tincture, because it's contained more than 60% alcohol. Anything else?
In non-alcoholic patient, if alkaline phosphate increase.
I answered this, Vibha. I answered this.
Okay.
Okay, so we'll wind up this session.
Yeah, sir. So, thank you so much for giving your valuable time and sharing with us your experience about the liver diseases and how we can manage the liver diseases with homeopathic medicine only. So, it was a really a wonderful session, and I must say your center is a unique thing because you are working only on the livers and that too with homeopathy only. So, that's really you're doing a great job, sir. So thank you so much for sharing your, giving us your valuable time and all your experience, what you gain in your practice till now. So on this note, we are going to end our session today in here. All of you, I'd like to thanks all the participants. Still, our webinar series is going on till 10th of the November. So daily our webinar series time is 8:30. So join us to and learn from different speakers here. If you have any doubt, you can write to sir. And if you have, and if you like this video, just like, share, and subscribe Aisha's YouTube channel. And thank you so much, sir. And thank you all the Aisha team for supporting and managing this program. Thank you so much.
Thank you. Thank you. Thank you. Good night. Good night, Vibha. Good night, the
Good
team.
night.
Okay.
Yeah.
Hello guys, tomorrow we are having a webinar by Dr. Rohan and Batake sir. Topic is basis if tobacco de-addiction. So at 8:30 p.m. So like, share and subscribe to our channel. Thank you. Good night. This is Lavanya Sai signing off.